Hello, this is McKayla Davis. This is my positioning my patient for radiographic study videos. I have a kitty cat that we have euthanized earlier today, and I got permission to use them for my schooling. First, we're going to do a lateral of the skull. I'm going to position my crosshairs smaller so we don't need that much space out. Anytime you do the skull, you want to line up the crosshairs right at where about the end of the point of the eye. You don't want too much space out. And make sure the head is flat against the table, of course, and upright for a lateral view of the skull. The point of the ear, line up the crosshairs. Make sure you can see. A VD of the skull. You would, of course, flip the baby on the back. Use my assisting elastic gauze, and you would line up with the gauze. Line up the basically the jawline at most point for the VD of the skull. And the VD of the cervical spine, I'm going to go down lower, make my crosshairs a bit smaller, not longer. You want to start at the beginning of the cervical spine, which is right below the skull. You would, of course, have your animal sitting upright, and you would move your arms. Flex the arms out, like so. Make sure the animal is lined up with the crosshairs as far as the vertebrae go. Right about the beginning of the cervical spine to the end, and you would take the x-ray. Flex lateral view of the cervical spine. It's kind of like the lateral for the skull, but instead you're going to be focusing on the cervical spine and not the skull. Make my crosshairs smaller so I know what I'm focusing on. Line them up right at the beginning of the cervical spine. And then I would take my x-ray. That's my flex lateral view. The DV of my thorax, I'm going to go ahead and make my crosshairs wider. Not that so much wider, not that big of a patient. But you would want to put the baby on the back and line up with the thorax. I have some of my abdomen in that view. I'm going to make my crosshairs smaller. Stretch out the arms. My crosshairs are pointed right at the thorax. You take your shot. I'll do my lateral. I'm going to do right at the beginning. Just pretty much under the arms. The chest area for the thorax. Make sure you get the heart, and one of the main subjects for a thorax view. Right in that lateral view, you would stretch out like so. And then, let's see, the VD of the abdomen, like the thorax, but of the abdomen general area. Make my crosshairs. It would pretty much be the same, but you line up your crosshairs right in the center of the abdomen. Stretch out your patient, like so. Make sure it's lined up and the vertebrae is nice and straight where you shoot your shot. And then the lateral abdomen, of course, the same as the thorax, lateral abdomen, except different general areas of the body. I'm going to take a shot of the kitty cat's abdomen. I'm going to put on my protective gear, my thyroid shield, my gown, or lead vest. I put on my safety gloves. I have on my protective gear. Always use your marker when taking an x-ray or your lame. Line up my cervical, or my spine. Cervical spine. I got cervical spine on the brain. I'm going to shoot my x-ray. My marker involved. Fix my x-ray a little bit. I thought my area was a lot wider than it was. Try this one more time. For my abdomen. Lining my crosshairs up. Make sure my marker's in there correctly. I'm going to show you my view. My feline lateral abdomen shot. And now on to the puppy shot. Hello, this is McKayla Davis. This is me doing my positioning of patients for radiographic studies video. This is Daisy. She's going to help me with my DV thoracic exposure. Put on my gloves. Hang on. I've already measured her. This is her left side. Position for the VD. Shoot my x-ray now. Put Ms. Daisy down. Show our DV of our thorax.